Hello, YouTube and BitChute friends. This is part 2 of follow-up. This is going to be a lot quicker because I covered in my last video, I covered what I consider to be my protocols on stage 4 prostate cancer clinical diagnosis. And one thing I forgot, a friend of mine who also has prostate issues, not on the level that I do, but cherry tomatoes. He's been eating this sort of like melange of cherry tomatoes. What are they? A blended flavor cherry tomato. Rinse and enjoy, product of Canada. This unfortunately is not a. It's not organic. I'm eating everything I possibly can on the organic side of things. This unfortunately is not organic, but still, sometimes you can get it, sometimes you can't. Cherry tomatoes. So my buddy, I've been eating them for about 4 months. I think he was a PSA of 10 or something, 8 to 10. So he has a slight enlargement of the prostate, BPH. I don't think it's cancerous. Tumors are cancerous. So he has been eating for 4 months now, every day, a pint of cherry tomatoes. And he was having difficulty peeing. And he's perfectly fine with his peeing now. So the prostate has shrunk. He's managed to reduce the prostate. As far as he's concerned, he hasn't done anything different in his life other than having the cherry tomatoes. And the other thing that I'm having are pumpkin seeds. I'm having pumpkin seeds, which are very good. Apparently, the same way cherry tomatoes have lysine or something. I think my shithead urologist, I asked him about it, and with his great sense of irritation, told me, "Oh, well, it's because they have lysine." Imagine if cherry tomatoes are the go-to solution to a BPH, how cheap that solution might be. It'll put urologists out of business. Anyway, I want to thank already quite a number of the responses and personal emails I've got, people wishing me well. So I truly appreciate that. Thank you. And I do believe that when we generally as human beings rally behind the well-being for someone, for us, we become a sense within ourselves of the well-being we would like to see around us and pass this on to other people. I do believe that helps. I think that is the type of energy where people have done experiments, for example, with plants. And if you talk to plants with that sense of care and wellness, to send vibrations like mental thoughts and mental air going through the airwaves, the mental stuff makes a huge difference, which is partly what I'm going to talk today about in terms of my own condition regarding sleep. I didn't touch on that the last time, but it is connected to this idea of what we understand to be well-wishing. In other words, having a conviction about ourselves to be a better person, and that includes wanting others to feel better as well, rather than being judgmental or critical, even if it's difficult. This is something, it is a challenge. It's because our inclination is in this sort of like withdrawing into a shell feeling of self-protection, that judgment. We feel like we need to protect ourselves all the time, and that is actually quite detrimental to our mental and physical health. And it's something I've learned over the last, particularly since this has occurred, that I have been confronted with this challenge of having to heal myself. Notice, people, I say heal myself because I broke it, I fix it. I'm going to take all the advice I can, all the suggestions that make sense, but ultimately we all need to take charge of our well-being and healing. Doesn't deny people have insights and abilities to uh, suggest and push us in the right direction. But just to sort of go run to the white coats and say, fix me, I'm broken, is a big mistake. And especially from the point of view, the way I have understood it is that what we see as, or what I consider to be the medical establishment, is totally useless in regard to chronic disease and illness. So the chronic side of things is basically a huge moneymaker not to resolve or find solutions. So when you think about the cancer issue has been going on, well, I mean, cancer has been around forever, I'm sure. These uncontrolled cells didn't just pop up out of, in recent times. They've been there since the beginning of humanity. Probably, well, not even probably, for sure, not on the level they are now, because I think cancer is the second highest killer of people, other than supposedly heart attacks. And my ND said, why do you think there are no tumors on the heart? And it's because the heart, apparently, I didn't know this, doesn't recreate cells or make cells the way, like, for example, skin or the intestine. The reason people get tumors in intestines and get skin cancer is because cells tend to replicate very rapidly, continuously, whereas certain areas of the body, I asked them about the brain, which supposedly doesn't create many cells anymore once it's intact, but that's obviously wrong, because the brain must also produce new cells. In order for there to be a growth, a tumor in brain cancer, you have to produce cells. So the brain obviously produces cells on some level as well. So my thoughts on this, and what I'm communicating and why I'm making this video, and I've been gone for a few months. I've been reflecting and dealing with this and healing myself. I am healing myself. I mean, I'm going through this, and I may very well have already overcome the C or cancer part of it, whatever they've diagnosed, correctly, incorrectly. Who knows? I didn't go for the fucking biopsy because the risks associated with the biopsy, as I think I mentioned in the last video, my nephew called me that one of his friends had the biopsy and he's in the shitter with this biopsy thing because he's got a massive infection now. He's bleeding from his anus and he's got a massive infection, and he may have trouble peeing in the future because the fucker who did the biopsy, they go in with their 12 needles and rip out some chunks of meat and put them under a microscope to tell them what they already know anyway. I mean, show me differently. It's like if you suspect prostate cancer, or we can't do the treatments unless we know exactly what it is. Well, your MRIs and things appear to be rather definitive. You white coats are very much in favor of diagnosing something on a percentile basis, but you're not interested in treating on a percentile basis. So I don't understand this. If there is a C in the body, why do you need to know exactly what kind of C? Okay, enlighten me. I don't know. Maybe you do. Maybe you do. Okay. Well, as far as I'm concerned, you can stuff it. I'm not interested, especially that the principle of healing for me. I want to make this perfectly clear. This makes absolute sense to me. You do not introduce anything into a body that doesn't exist in some form already anyway. So you could argue that, well, natural elements may not exist in the body, but there is such an incredible complexity that we don't actually know all the elements that are in our bodies. I mean, when you consider the number of chemical reactions and reactions on a minute or even second to second basis, it's just phenomenal. The chemical reactions in our body every second, it's hundreds of thousands or even millions of reactions all the time. And how do we know which elements are there, which aren't? One thing I do know, the elements they introduce into people with radiation and chemo is not a natural thing in our body. So I have enormous resistance around this because there would be repercussions based on something you introduce into your body that is as toxic as the medical establishment believes they can whack the shit out of something with something that is even as toxic, and they cross their fingers. If like cancer cells are part of our body, they exist anyway, so we need to fight them with the body. That's the concept, that's the principle I was outlining. And obviously the proof is, as they say, going to be in the pudding. Does Ackerman survive? Does Ackerman die? I'm going to heal. I'm going to get through this like people who are committed in their understanding about the nature of the mystery that we are a part of. It's not like an isolated thing, and you've got these medical white coats with hammers looking for nails. I think there is a lot more to this process I'm going through than finding a nail to hammer into a 2x4. Anyway, I'm going to be very interested to see. I started on the cherry tomatoes. I didn't take them seriously. I started on the cherry tomatoes about 2 weeks ago now, maybe 3. And he's been doing it for 4 months. And in the last 3 weeks or so, after 3 months, he had a result on being able to pee normally and doesn't wake up during the night. And I'm progressing towards from having to get up 5 times a night to maybe twice, maybe 3 times now. So I'm able to sleep 3 hours, 3.5 hours. So twice, I wake up twice. And sometimes because I do get cramps in my legs, and I think it has to do with magnesium. So I have, as I mentioned, I have increased my magnesium by glycinate and citrate, magnesium citrate, citrate. I've doubled the amounts from, I think they were 300 between the two of them or something like that, to 600. So my magnesium levels are higher. So I am actually conflicted now. In my last video, I said I'd like to know, I get an MRI. And one of the things I'm having difficulties with, and this was something that I was considering happened when I had the abscess about 4 years ago on my intestine, and they drained it. They did a CT scan, and what they do is they inject you with what they call a contrasting agent, and I think it's in a CT scan, it's iodine based. There's a name for it, which starts with a G. And they say it's rather benign, but hey, they're heavy metal stuff, and it could actually have triggered. This is what I was thinking when I got my CT on my abscess. The injectables, the contrast agents, may have actually triggered a cancer. It's possible, because they don't rule this out, that there are side effects to that agent. I don't know if they have something that they can confirm is more benign than what these, I forget what the name of these are. There are different agents. And I'm rather conflicted now about finding out whether or not I am at whatever level of stage I might be at, and which may in fact contribute. They say it flushes out of your system, but there is residual. Who knows? If I've already been toxic, which I was 4 years ago, quite toxic, and I don't believe I'm even near the level of toxicity I was 4 years ago. But still, I am very resistant to adding new toxins, heavy metals, or whatever it might be, considering our environment is full of them anyway. I mean, we get it all the time, but this is a direct injection, which is, it gives me pause. So as much as I want the MRI, I'm now reflecting on the possibility of just going through my process. And as I begin to feel better, and my situation improves, I don't give a shit what I would see in an MRI. I don't need to know. I just know that I need to have a certain lifestyle that will continuously improve or make me feel good, like physically good. So I don't need to have a confirmation from the pharmaceutical bunch, that, yeah, hey, bless you, son, you're doing well now. And I understand that my ND said cancer is a very nefarious um, illness, in the sense that you don't notice it quite often until it's too late. And I've heard many people, even in the Jensen protocols, where people had illnesses that were quite advanced and they were at death's door. The Grim Reaper was standing with his scythe right in front of them, and they had a recovery because they did a radical detoxification and protocol that people that were desperate, even Cliff High, when he talks about it, he was on death's door. He had a tumor in his intestine. They removed it. He was within hours, he figures, of he had the ride in hell, he says, in the ambulance taking him to the hospital, and an overweight surgeon who knew his stuff removed the tumor, and he's Cliff High. Check him out. I must say, I respect this guy. He's actually gone through it, which is what I said to some of the people that commented and said they'd be happy to give me access to their expertise. I said I'd like to have the expertise of people that have actually seen the benefits for themselves, or people that they've helped with what they've done. And I'm not talking about just a year or two. I'm talking about long term, like 10, 12 years. And even though I'm older, uh, obviously there's a difference when you're 30 and you get sick, and when you're 70 and you get sick, or 80. There's a difference. I understand that. But the considerations don't change that much. Maybe a little bit, but not that much in terms of people that are older. Okay. So, yeah, the cherry tomato thing, people, I'm not going to argue with my buddy. He's feeling better. He's sleeping and peeing normally. So I don't know what he has in terms of his PSA results. If he did it again, I'll have to ask him whether he's got a better number on it. And the pumpkin seeds. The pumpkin seeds, in terms of uh, I mean, I have nuts like Brazil nuts and walnuts and hazelnuts and almonds, and those are very nutritious in terms of the fat content and all that kind of. When you're on a vegetarian side thing, I do have some feta and eggs occasionally. Cheese that breaks primarily is the cheese that I like, and I'm enjoying my coffee with. Actually, I use whipping cream now because attempting to stay on that low carb side of things. It's interesting that the regular milk, Fly, you're going to die. You've been bugging me there, dead. The regular milk has a higher, has a carb content of per serving of, let's say, like 12 or 14 grams per serving or something like that. And sugars as well, 6 to 10 sugar grams. I don't know. Homogenized milk. I would have thought the other way, that like high, like a whipping cream has 0 carbs, 0 sugar. If you're sort of concerned about that, if you're on a diet that is staying into that keto side of things. And I'm not very keto. I measured myself today. I'm not very keto, actually. And the way I get into keto is doing a water fast, which I'm going to start doing probably. I, I got some veggies I'm going to eat. Maybe in a day or two, I'll be done. So as of Monday, I will probably go on my water fast 3 or 7 days. I'm not sure. I'll see how I feel, because I've gained a little bit of weight. I went from around 162 or so to 166, 168. I'm kind of hovering. So there is a sense of energy. And I had been feeling lightheaded, and I mentioned this, and my ND thought it had to do with my thyroid. It was underactive. So I've been supporting the thyroid with, I put dulse in my greens and my salad. And I clean my teeth with a water pick every night. And I put Lugal iodine, a rich amount of Lugal iodine, like a dropper, like I fill a dropper and I squeeze it all in. And then the Lugal kind of disinfects and is absorbed through the skin, and I just swallow a little bit. So there is iodine. I'm kind of supplementing the iodine in terms of my thyroid. And as a last note, in my overall understanding of the world that we live in, which is not as it appears to be, whatever it is you think is real is not real. There is a level of complexity underlying, both nefarious and beneficial. I think the world is not as it appears to be in ways that are beneficial and adversarial to our well-being. So my focus has been on the adversarial side of things, where the mucky fucks, the bastards who are trying to undermine our well-being, are very active out there, especially now. Do not think at one moment that you can relax and rely on the goodness of the people who are entrusted, like doctors, the white coats, with our well-being, because they have fundamentally been compromised. And the compromise was confirmed to me, through the COVID shit show, when the medical establishment exposed itself for its compliance to meaningless, ridiculous ordinances. The idea of distance or mask or an experimental drug of some kind, it's not a vaccination, forced on people. Oh, you don't have to take it, but you can't be part of society. That is a coercive act. That is a forced inoculation. And this is something that I would say 70–80% of the medical profession went along with this. They all became Dr. Mengeles. All these white coats that are sort of soft, that smoothly navigating the system now, like this urologist fucker that I dealt with. He's smoothly navigating himself still. He's complied completely. In order for him to operate in the system, he had to comply. And everybody that resisted it is having a hard time. Whether or not they're being thrown out or whether they've been reprimanded, I don't know all the things that have happened to these people, how they have been peripheralized in a system that I would even suggest you don't want to belong to that, because every time you comply with something within a system that is so nefarious and broken in the best sense, and I would say that the intent that the snake on whatever pole it's climbing up on, trying to climb up our pole, the medical snake, is actually been instigated and programmed in order to destroy. I mean, I don't have any other explanation after the shit show that happened to us over the last 4 years. I mean, the idea that highly intelligent, so-called highly intelligent people are able to just abdicate their ethics and morality to some kind of higher power that supersedes their own conscience is reprehensible, to say the least, and absolutely nefarious and dangerous to the well-being of all of humanity. When these institutions establish themselves in such a powerful manner, like the pharmaceutical medical complex, and then show themselves exactly how they are, the world is not as it appears to be, but in this case, it's quite clear to me that they cannot be trusted. And any level of their interventions, especially on the chronic side, has shown itself to be totally useless. Look at cancer, 80 years of research. Okay, so what? The proof is in the results of the benefit to people. And if you create phony statistics, like if you're surviving 5 years, you're a survivor, and if you die 1 day after 5 years, you're still a survivor in our statistic. Well, it doesn't cut it. It doesn't work. So that's my comment on the establishment, and anyone that approaches healing from the point of view of adding more toxins into your body is extremely suspect. There may be an instance, for example, in my case, I have to say that I was on a massive dose of antibiotic, which is highly toxic to the body in certain ways. It's called antibiotic. So we are biotic beings, and to have something antibiotic come in, however, it saved my ass in terms of the infections that I had, the internal infection. So I'm not 100% I'm not 100%, unless there's an equal natural product to antibiotics, but it actually acted extremely quickly. I mean, it was a matter of even hours, I would say, that there was a reduction in my fever, and the infection over a day and a half was under control. So there are aspects and elements to the pharmaceutical side that appear to be very effective. All right, I'll leave it there. Now, I just want to, I'm going to finish off. Um, I may have left some things out in the protocol that I'm doing, uh, but the one thing that I feel has really uh, been very beneficial is to establish a mindset for myself, which this is difficult to explain, because when you're dealing with the mental side of things, people say, "Oh, well, just aum and meditate and yoga, and you're getting into the right frame. It's Eckhart Tolle stuff and all this." All right, it may work for some people, but it doesn't work for me. I need to have um, it, like it's hard to explain, because when I make a painting, let's say, okay, in the painting behind me here, I call this, I did a series of paintings early on when I was diagnosed. I called them prostoxicology, and it was actually an image that I got off my MRI that showed my prostate to be problematic, and whatever it is, it had metastasized, all this kind of stuff. So I made paintings, and it sort of created a buffer between my physical world and my mental world. I think it created this sort of, if you want, a meditation, a calming sort of meditation like this. I did about 5 or 6 of these paintings that expressed they're intense. I'll sort of put them into this video. The ones I have, I'll splice it in. So in terms of getting on the path of healing, what I needed to do, and as I said, I didn't sleep sometimes for like 24 hours a whole day or even longer, because this urologist fucker had got into my head. And to remove this sort of voice wasn't just like, oh, calm yourself, count backwards, all that kind of shit. No, it didn't work for me. It may work for some people to create a sense of calmness, so that you need to heal in a very balanced, calm environment. So sleep is a high moment of calmness, so to speak, or should be anyway, without anxiety. So when the mind races, my mind tends to race. It's very difficult to slow it down and make it stop, no matter what I said. This just kept coming up. You're going to die. You're going to die. What the urologist said to me, you're going to die one of the worst deaths. Like, he actually said this to me. He was so upset with me that I had refused his treatment, that he said, you're going to die one of the worst deaths you can die. He said this to me. This is the level of depravity that has set into these people who've compromised. They were probably even compromised before. The system punched any kind of compassion or feeling out of them over the 15 to 16 years he's been practicing. I hate the fact they practice. I wish they knew what they were doing rather than just practicing. I don't practice painting. I make fucking paintings that either are fabulous or they don't work. And if they don't work, I discard them or I learn from them. But I don't practice. When I do something and hang it on the wall, I have decided this is the ultimate of my insight and expression. And it's not a question for you. It's something that you can take in and feel very good about looking at, because I have sifted through it. I have chewed through it. I haven't practiced through it. I have chewed through it to make it the best it can be as far as I'm concerned. So I'm not practicing at this point. It's sort of like Picasso once said when he was asked about how do you approach your painting when you're looking at other people. And he said, I don't want to see your questions, I want to see your answers. And that's how I feel about a white coat. I don't want to see you practicing and ask questions. I want you to actually know for a fact. And if you say you know and the proof is otherwise, well, you're out the window. I don't give a shit about you, because the proof is not in practicing, but in actual results. All right, so just okay. I'll finish this off here. It's getting longer already, 30 minutes. Um, okay, so I'm like lying in bed, and it's, I go to bed at 9:30, and it's not working. It's like 11 o'clock, and then it's like 1 o'clock and 3 o'clock, and I'm still on tossing and turning and whatever, and nothing I can do. So I actually came across a YouTuber who talked about the idea of how to instill this calmness in the mind to be able to sleep. And there's a combination of things. I went with Bernard Jensen, who suggested the warm bath before you go to sleep. Okay. And I introduced Epsom salts or magnesium baths. You take maybe 2 cups in a nice full tub, and you lie there for 20 minutes, half an hour in a hot tub with the Epsom salts. And and then the relaxation is total. I mean, when you get out of the hot bath with the Epsom salts, it's like just phenomenal, the relaxation and all that stuff. And as I laid with this, it was much easier to feel relaxed. And I I said to myself, based on this YouTuber, which was great advice, I said, if I can't fall asleep, it doesn't matter. It's okay. I didn't make myself more anxious because I couldn't sleep. I just said, well, if you can't sleep, you can't sleep. Get up and do something. Get up and read, or lie and read, or watch a show on TV that's not upsetting or anything. Just do something. Don't say, oh, you have to sleep and I can't sleep, and it's like hammer myself. So I did this for a few nights, and I realized all of a sudden I woke up to pee, but I realized that I realized I was having dreams. So there was a point at which I didn't know whether or not I had slept as I'm entering into this ability to sleep. I didn't even know whether I had slept or not. So I finally realized, well, I must have slept because I remembered dreaming. So in the beginning, I would sleep for maybe an hour, hour and a half. I'd wake up, I have to pee, and I thought, oh, I'm still awake. And then oh no, I was dreaming. So in fact, I was sleeping in that period of time. And this started to speed up. So I'd have to get up, and then I think within 4 or 5 minutes, I would be asleep again. So I was, under the circumstances, I was getting some optimal sleep time, which is very healing, we need. And on top of it, when I wasn't able to sleep, uh, Bragg insisted that even just the lying down and just closing your eyes is not exactly like sleep, but it's almost 90% a sleep state. So that in itself calmed me too, that even though I may not be sleeping, I was still confirming within myself that this healing process can happen even in a state of just total rest and lying down. And I think within probably psychologically, as I introduced these ideas that I'm not worried about not sleeping, I think what happened, I was so tired that the body finally just says, look, I don't give a shit what you're thinking. I'm going to sleep. And that's been for the last 3 months now, 2.5, 3 months. So whatever it is that is going on that I need to get up, I'm still able now, generally speaking, within a very short period of time to go to sleep, because I don't put pressure on myself for not sleeping. So that's my advice to people who have a difficult time sleeping. Don't put pressure on yourself. Just let it be what it wants to be. The body will finally fall asleep anyway. Plus, I highly recommend before going to bed that magnesium bath. Like submerge yourself in as hot as you can take it. I let it heat up. I go in, it's a bit cooler, then I let it heat up, and it's quite hot by the time I'm done, and I lie there for 20 minutes, and it makes a big difference. So that's my little add-on. Wow, 35 minutes. Okay, it's a long part 2, and I'll keep you posted. I have today. I'm going again. I go twice a week for a vitamin C infusion with the mistletoe and a few other elements. It's the European Helixor, I think it's called, the mistletoe. There are different mistletoes. The European one apparently is the one you'd like to have in you if you have a cancer issue. And I'm going for my treatments twice a week. High infusion. I'm at the level of 50 grams, and I think it's 60. The mistletoe is 60 milligram. I think. I'm not sure what the count is on the mistletoe. And the interesting, okay, just a side note on the difference between the liposomal and the IV infusion of vitamin C. That ND told me that at those high levels, at 50 grams of vitamin C, it converts itself to hydrogen peroxide, I think he said. What? You know, the stuff when you have like an open wound and you disinfect it with hydrogen peroxide, apparently vitamin C is converted into hydrogen peroxide. And this, for some reason, I mean, you can't drink this stuff. That would kill you probably, I think. I don't know. But in the blood, for some reason, it has a very beneficial effect in the scheme of things. So vitamin C on the liposomal side, or any other kind of side when you take vitamin C, it becomes a molecule that is absorbed in the cell and does its stuff, whatever it does in healthy cells, and does whatever it does in the shit cells. And in the shit cells, it kicks the crap out of them. And that's what you want either way. So the liposomal I'm doing, plus I'm doing the high the high dose of vitamin C infusions, and I believe they are very beneficial. And well, time will tell, I guess. So I'll leave it here. I'll show you some of my prostoxicology paintings. All the best, and thank you for the people that have wished me well, and I appreciate it. I do, because it makes a difference when we think well about others. There's no reason to think badly of people, other than maybe I'll make an exception for the bastards who are trying to undermine us. I reserve the right to feel really judgmental toward those among us who are undermining our well-being. I reserve the right to feel really antagonistic and judgmental. Now, all those feelings too, you know, when we have these feelings of, let's just say they're the unpleasant side to us. They affect us as much, I think, as they would also work externally. Like the well and the bad maybe work the same way when you wish well on someone or when you wish somebody badly. All I'm saying is that I understand we're being undermined, and we cannot be blind to that. We need, no matter how Eckhart Tolle you want to be, you need to actually have that reality part of it as well. That, you know, you're in the trenches and the enemy is coming on you. What are you going to do? What are you going to do? You're going to just lie there and let them roll over you? No, it's not my nature. It's not my nature. And it's not a matter, oh, you're a fighter and all that. No, it's like we have the responsibility. The omnipotent being has given us, allowed us to be part of this mystery. And just to kiss off on it that way, it makes no sense to me. I may have an enlightenment, and I'll let you know what it means to be passive and clued in. I can't see it. I've never seen it. And I mean passive in a good sense. Maybe that's another video. I'll just leave it there.